It's no secret people with a history of smoking are at a higher risk for lung cancer. Some people, like Big Bang Theory star Kate Micucci, got it without ever smoking a cigarette. Research shows lung cancer cases have risen among women in recent years. Joining us today, Simran Randhawa, an assistant professor in cardiothoracic surgery at the CU Anschutz Medical Campus. Thank you so much for being with us today.
Thank you.
You're just saying they keep your schedule pretty busy, so we appreciate you giving us a few minutes.
Thank you.
Before we get into the meat of everything, can you talk to us about how common it is to get lung cancer without smoking? Because it's really something we put two and two together, but it's kind of scary to think that's not the case.
Yeah, so lung cancer in never smokers is on the rise now. In fact, about 15 to 20% of patients that I see in clinic with lung cancer have never smoked a single cigarette in their entire lives.
Wow.
And it's now the 7th most common cause of cancer deaths in the US and worldwide.
Wow. Why do you think we're seeing it more commonly in women over men? Any reason with your expertise?
There is a lot of research that's going on in the realm of women, especially who are never smokers and are getting lung cancer. There are a lot of reasons that we get lung cancer without smoking. Some of the most common ones are exposure to secondhand cigarette smoking, environmental pollution, asbestos, radon.
Yeah.
And there's also a genetic mutation that we're seeing very commonly, especially in women who are never smokers and getting lung cancer, because of which we're trying to do a lot of research into this field now.
Absolutely. Share with us some risk factors that we do need to be watching out for. You mentioned some of them.
Yeah, so like I said, the most common ones are exposure to secondhand smoking, environmental pollution, which has been on the rise now, especially—
Things we can't control.
Yeah, exactly,
Yeah.
especially in the developing nation.
Yeah.
Just smoke out there and environmental pollution. If you've had exposure to asbestos, and most importantly in this part of the country, I would say radon exposure is very commonly linked with lung cancer.
And can you share with us a little bit about, I know surgery can be an option, but what are some other treatments as well?
Yeah, surgery is the best option if we're able to get it out. That has the highest chance of cure. However, if you're not able to undergo surgery for any reason whatsoever, you can get spot radiation to that part of the lung cancer, which has a great chance of cure. And there is a lot of development in the field of chemotherapy now, and it's really an ongoing research.
What are some symptoms we might see and say, hey, we got to call the doctor, this is a concern?
Yeah, unfortunately, early stage lung cancer patients do not have any symptoms, and the best way and the only way to find it is on screening CT scans.
Okay, so that's a little scary. Okay. All right, share with us, you know, January is Radon Awareness Month. This is something we really wanted to touch on. This is a problem specifically in Colorado. Share with us, you know, that connection with lung cancer and radon.
Yeah, so radon actually is the 2nd most common cause of lung cancer after cigarette smoking, and it is independently associated with getting a higher chance of lung cancer. In fact, if it's synergistic with cigarette smoking, so if you are a smoker and exposed to radon, you have a 20 times higher chance of getting lung cancer than if you were smoking cigarettes alone. So this is the best time to be aware. I think everyone should get their homes or even their rental properties tested for radon for this very reason.
Good tip. Thank you, Simran. We really appreciate you taking the time in your day to chat with us.
Thank you for having me.
Of course.